Hello.
Hello. So it looks like Dr. Marvel's on as well. But
Yep.
we can't see him or hear him. Oh, there he is.
All
There
right.
he is.
Oh, he's still, yep. Hey, Jim, how you doing?
Good. Are
Hey.
we the only ones just,
At this point, yes.
Hey, Mayor Becker.
So far.
Hey, Ted.
Hello, how are you, Patty?
I'm good. Can I ask
Yes,
a real quick question? Why have you on here?
please do. Sure.
Pastor Baker from our church is going to be retiring in June.
Oh, really?
Yeah,
Okay,
we're trying to keep this a secret. But if we can't do a dinner for him,
okay.
they want to do a street parade.
Okay.
And I need
End of June, maybe. I don't know.
Well, it'd be like June 20th. Just some parishioners go down the street and wave at him.
Okay, yeah.
And
We
I
can
and I
probably
know-
handle that.
Yeah, I wouldn't wouldn't be more than 70 people max. I mean,
As long as they. Go ahead.
I just need to know what proper channels to go through.
Well, let's get you, once you get a permit from, through the Parks and Rec Commission, you can get one off and then just fill it out, give us the information, the route of the go from there.
Oh, okay. That sounds fine. And if we can have
That
the
would be
dinner-
the easiest.
I can't hear you.
Okay, yeah, let us know.
Yeah,
And make sure you give me some information. We'll do some kind of a proclamation or, some kind of recognition of his service to the community. Okay?
oh, good. Yeah, he's retiring officially from everything. So says farewell to preaching.
Really?
Yeah.
Is he gonna stay,
Yep.
is he gonna stay in the area?
Oh yeah, they're gonna continue to live here. He's just decided that, that he needs to give some time to his family now. So,
Got it.
but anyway, I
I understand that.
Yeah, I will get the proper permits and whatever we need. I just needed to find out what I have to do. All right. All right.
Sure, that would be the best way to handle it. Great.
Okay.
Thank you.
Thank you, Mayor.
Thank you. Mhm. Hmm. Okay. Well, we need Jane and Nancy yet.
Right. Did anybody, well,
That's it.
and Sue,
Susan Megger. Yeah.
did you by any chance talk to Dr. Tam?
who, me?
I did not.
Either of you?
No, have not.
No.
I did not.
I wonder whether
Okay,
the
we-
hospital has reached what they think is a surge level. I'm not sure.
Based upon what I'm hearing, they have not. I'm hearing their
That's what I'm
census
getting the
is still
impression.
up.
Not, but
Yeah, what I'm hearing basically is that, it's they're mostly not they're not at a surge level.
that's generally what I'm hearing as well, but I just didn't know for sure.
Yeah,
Appears that the hot spot now is Milford, Millsboro area.
The Georgetown
Oh.
zip code passed 301 today. We have and I guess we can talk about it when the call starts, but Newcastle County has 1,352 positive cases. Sussex County has 1,317. So we may pass Newcastle County this week.
Right, is that just today's numbers?
we
Mhm.
might.
They come in
Yes,
soon, because the
Yeah.
numbers I have are yesterday.
Last night, yeah, well, the governor was saying, Anne Marie and I were on a call with the governor earlier this morning. And he was saying that we would easily pass 3,000 today, and obviously we have. But the hospitalizations, according to yesterday's numbers, and I guess those are the same numbers that you have, are relatively low numbers of 263 as of yesterday,
Right.
with 71 being critically ill.
269 as of today.
Those are relatively.
What
Okay.
were the numbers today, Anne Marie?
269
And if you look at that
hospitalizations.
269 hospitalized?
And then the other thing that was interesting,
Yes,
the other thing that was interesting is the 565 recovered, which is a good number.
which is now
Hi, Nancy.
599.
That's good. I noticed also in the report yesterday that came out that, you know, the deaths in Sussex County, 4 of the 5 that were reported in yesterday's report were people who were in long-term care facilities.
Right. I
Is,
guess- Nancy, we see
yeah,
you.
I-
I can see you. Can you
We see
hear me?
Nancy's name, but I don't, we can hear you, but we can't see you. You're hiding.
That's a good thing.
Oh, I
Not
don't know
sure
about
why.
that.
I can hear you guys. I can see you guys. Let me go out and try it again.
Okay.
Okay. Looks like we have Bonnie, Ellen, Lorraine, and Nick on also. so.
Yep.
Okay. And Sue Ann now.
okay. All right,
We lost Jim
Yeah.
and Nancy. That's you. You're back.
It says screen name. What do I put there? Register for this webinar.
there's
you were.
Nancy.
Yeah.
Okay, Nancy, we've got you. We're working on getting Susan Madler in too. but-
And Susie Madler, it's asking for a screen name on her.
Oh, and she can type whatever she wants. She can just put Susan on there.
All right, yeah, that's right. Just put your name, Susie.
Just my name?
Yep.
Okay. And then it's asking for my email.
Right, well, that's yours.
Yeah. I figured it was something dumb. You know,
Yeah.
not easy.
Yeah, you can see when I didn't have to do that. Mine just comes up as Patty's iPad.
Well, see, Zoom would like to access the microphone.
Oh, I got,
Susan's in now.
I have Susan here.
You just have to upgrade her from a.
Yep.
Okay,
Disconnecting.
Okay, give it a minute.
You're on now.
Oh, okay.
Has she got her?
She is, but she's muted. Now she's come off the muting.
Don't, yeah. Okay, she might not know to do that part.
She's
I
not
just
muted.
unmuted her.
Okay.
Oh, Chris is on from the hospital. That's good.
Let me see something.
Chris, where do you
Christine.
see?
There you go.
Yeah,
okay,
you're seeing Christine Ho is on.
Oh, okay. I'm sorry.
Yeah.
Okay.
In the meeting, yeah.
all right. So we got everybody, it's Jane, I don't know whether Jane's gonna sign on or not.
I don't know. Okay.
Maybe we can go ahead and get started then.
Okay.
How about the minutes of the previous meeting? You
Yeah,
have those?
I don't have them done,
Okay,
so I'll get them.
What have you been doing?
I know.
A whole lot of these calls. What we
Yeah.
have been-
I've been zooming.
Well, Anne Marie has the current statistics. I have yesterday's, but the new ones just came out, and they do show that the Sussex has, what does Sussex have now, Anne Marie?
1,317 positive cases.
Anne Marie, is there a breakdown by zip code?
Well, so there's a map by zip code, and the hot spot right now is Georgetown. The Georgetown zip code has between 301 and 325 cases. They're reporting it by range.
And
The
Millsboro?
Lewis zip code is, it looks like we are in either the 51 to 75 or 76 to 100. Yeah, so we're in the 51 to 75 cases in Lewis.
That's the way I read it too.
Yeah.
And Millsboro is the other hotspot?
It's
Yeah, so Millsboro is in the 176 to 200 cases. And the Seaford and Blades is in the 151 to 175 cases.
and then it goes up 113 to Milford.
Yeah, so then Milford is in the 76 to 100 cases.
Right.
And all of
I
these
think-
people are served
Oh, I'm
by
sorry.
which hospitals?
Milford's in the 151 to 175 cases, sorry.
I think that the prime issue at this point is what about reopening? And I think that, some of the governors, such as in Georgia and Florida, have taken the reopening portions of their state, much to the chagrin of some of the public health people. And it appears to me that our governor is showing reasonable caution as far as reopening the
It's very-
economy, so forth is concerned. We all have empathy for everybody that's suffering in the economy, but by the same token, we have to be cautious about our approach to reopening,
Right.
because that could allow for a resurgence,
Right.
which, so I think that our job now would be, Ted, to support you in the city of Lewis in continuing with your restrictions as you've put them out, such as the closing of the beach and so forth. And I know, it has to affect you as well at the Inn at Canal Square.
Oh, well,
You certainly don't have many short-term rentals.
like none. But what you're saying, Jim, is very consistent with what the governor said this morning.
I agree.
And on the call that he had, he was looking for ways to begin to think about reopening, but obviously he's holding to the 14 days of declining numbers. And so, certainly the May 15th deadline is not certain. And based upon the numbers that you've just shared regarding the continuing increase, we probably will be beyond the 15th of May, but that's going to be his call. But he talked in this morning about, two tracks that he was concerned about. One being, finding out, getting additional testing going on. And apparently there's a Dr. Perry over in Georgetown who has a mobile testing unit. And she's going to be offering some testing at the poultry plants. And then there also the Christiana mobile unit is coming down to help with some testing as well. So that's
They're
good.
supposed to be over at Del Tech today, aren't they?
Right, exactly. And then, he's very concerned about, short-term rentals, and he talked briefly about farmers markets and had concerns about them possibly reopening, recognizing that it's very hard to control social distancing at farmers markets and things like that. His position has not changed that yet on those, that he still wants them closed unless they're in confined spaces, such as the one up in Middletown. And then he talked about restaurants looking very different when they do eventually reopen.
Yeah,
So-
I guess they're saying that normal will be the new normal.
Exactly, whatever that turns out to be. So he's
Right.
talking about, his approach is a two-track approach, one being getting more testing and the other one beginning to look at how do we reopen the government. Now, the Association of Coastal Towns, which we are a member of, all 7 communities that are along the shore here, will have a meeting tomorrow morning, a Zoom meeting, and we will be talking about what kind of recommendations we might offer the governor in terms of how the beaches may or may not be reopened. Of course, recognizing that anything we do has to be done in concert with what DENREC's going to allow in the state parks.
Right.
The other thing that the governor reported this morning is that he has been in contact with Governor Hogan to coordinate Delaware beaches with Ocean City. Because we have the visitors coming to our beaches are very much the same population centers that are visiting Ocean City. And in Ocean City, apparently the local officials are asking the Governor Hogan not to open.
Right.
Now, are we having any protests against the restraints, restrictions?
I think May
I'm not aware of it.
1st. I think there's one in Dover and on May 1st, I think is the date.
Nothing local though, Jim.
Okay. I think people have a right to protest. The thing is, they have to do it in the right way,
Right.
in an orderly fashion. And as long as they do it that way, I don't think, Ted, that you would have any objection to it.
No, as long as there's social distancing and all that kind of stuff,
I don't remember me attacking him.
but I actually don't have a groundswell. No one's reached out to me nor have I heard sub rosa that anybody's interested in protesting the failure to reopen. Have any of you heard differently? I have not.
No. Have you heard anything, Susan?
No, I have not.
I see
Everybody,
Nick-
everybody
I see
I
Nick-
know says to stay closed,
Right.
everything.
I see Nick Roth is on the call. Perhaps Nick knows through his sources if there's anybody in Sussex County or that he's hearing through the Gazette, whether there's a protest for getting to try and get things reopened. Nick, you want to respond to that?
Have generously brought it to my attention to save your own ass. No, sir, I'm not to save my own ass. This is what really happened.
Nick, hold on. Nick said something in the chat bubble. Oh,
Okay,
he's only heard of the Dover protest.
okay.
Traumatized. She still takes time to make a
So.
pie.
Okay, thanks, Nick.
So we're in pretty good shape there. And what do you anticipate anything else coming up for this coastal towns meeting, Ted?
No, I don't. I know that we've invited Mike Powell from DENREC to participate because he is representing state parks to that group. And we've also invited IG Burton and the other 2 county representatives who have coastal communities as well, John Riley and Doug. So I think hopefully we'll have a good discussion tomorrow. I know that I've been in contact with Paul Coons directly and Mayor Langen down in Fenwick. And they all have similar concerns about making sure that we continue to keep the beaches closed.
So that, I guess, is going to be one of the biggest issues for your discussion tomorrow,
Exactly.
about how long do we keep the beaches closed? And,
Right.
Right. And I guess the governor has not proposed closing the schools beyond May the 15th as of yet. But
Not yet.
he's intimidated or intimated that they may close for the remainder of the season.
Right. That question did come up today, and he didn't give a definite answer.
I think he's waiting to discuss it with the various school districts.
Right.
But I rather suspect that he will end up closing the schools the remainder of the semester.
Right.
But at least that's where we stand now. Now, I guess we don't have Cheryl with us today, but
Right.
you say that your impression is that the hospital has not reached the surge as yet,
No.
and hopefully won't, but
They did have one, I know that they, last weekend or last Friday, I think they sent out a memo, maybe you got it as well, that they had one recovery that was discharged. And then I've heard that they have, the other information I have is that they do have adequate PPE at the current time. So that's encouraging.
right.
And the
So it
governor,
looks like we're in fairly good shape and in Lewis anyway.
Yeah, and I think Dr. Tam, as he said before, he's working with the other hospitals in the area so that if there is a surge that needs more and we need to put up some temporary facility, they're working on strategies as to how that would be accomplished and where it would be accomplished. It sounds like all three of our hospital directors have come together very well.
Mhm.
Right. Well, do we have any specific recommendations to the city other than the fact that we want to support your concerns about social distancing and the stay-at-home request? That's not mandate. But want to support that as well as the continued closure of the beaches and short-term rentals and the restaurants. Is that my understanding? Is that correct?
I have two things I'd like to recommend.
Okay,
One of them is to consider the use of the bandanas or the masks.
Mm,
Particularly, I have reports that the grocery store in Lewis and one of the pharmacies, the pharmacist was not wearing a mask.
Hmm.
I think that common sense would indicate that those are both places where people should have masks on.
Mhm.
So
We
whether
have-
if common sense doesn't prevail, then perhaps the governor has to take action as other people have done. My second one is to suggest that in the public messaging, it's my understanding that in both phase 1 and phase 2 of opening up, that social distancing is still the recommendation for people that are vulnerable. That's a big portion of Lewis. By definition, it's 65
Right,
or people with underlying health conditions. But I think there's going to be a lot of people that think it's just everybody is okay. And it's going to be up to the governor, to the mayor, to Dr. Tam, others to emphasize that that's point number one in Dr. Bricks's plan, is that people that are vulnerable will still observe the
Right.
social distancing.
Right.
right.
I
I would
certainly
go
agree
back to
with
your
that.
mask. I'll go back to your mask thing. That was a question that came up this morning from one of the mayors over on the western side of Sussex. And it was interesting that Dr. Walker said that they haven't required it, but they recommended it for anyone. And of course, the issue is the mask is not so much to protect you, but protect other people from whatever you might expel. And so the governor has strongly recommended it. I understand your concern about the local grocery stores. Many of the grocery stores and other stores are beginning to require it of their employees. I know that Fresh Market made that announcement about a week and a half ago.
They may
The
want to
governor's-
consider requiring it of their customers as well.
Absolutely, I agree with you, Nancy. I know I do when I go out to the grocery store or the drugstore or whatever. But we can certainly encourage it in all of our publication, all of our information.
Now, Governor Hogan has mandated, I believe.
He has, absolutely.
But we have not. We're simply
Right.
recommending.
And also Governor Cuomo in New York has mandated it for anybody in public.
And I believe some of the places in California have done so as well.
I think you're right. Mhm.
Completely one-sided.
I know.
I let you know
Well,
my buttons when you were warning me.
The social distancing thing, Nancy, is a very good thing to stress. One of the things that we had a report on, and I don't think Chief Spell was on this call, no. But one of the things we had a report on was people congregating at the beach last weekend. And the police are using their UTV and other means of getting out and riding the beach. Obviously, they're there for a period of time. They're not there, all day. So it's intermittent. But they also have a drone that can provide, that can help monitor what's going on the beach. And also it has the ability in multiple languages to tell people to social distance and that the beaches are closed except for exercising and walking your dog.
I
okay.
walked the Gordon's Pond Trail on Sunday. I was not very encouraged by the behavior of people, not so much to do with the virus as just going way too fast on the bikes, not giving the pedestrians a warning. And I don't think any of us want to end up in the emergency ward at this point.
Absolutely.
And people were not being careful.
I have heard that from others. The trails are largely unpatrolled. The state police aren't monitoring them, and our bicycle police ride them occasionally, but once they get outside of Lewis, and if you're doing the Gordon's Pond Trail, once you get in the state park, they're not being monitored by anybody. So it really, I get what you're saying. It's a challenge. We'll call that attention. We'll bring that up tomorrow. I'll make a point of bringing it up during the ACT meeting tomorrow so that Mike Powell can perhaps respond to that. Maybe they need to put up some new signage about slow down.
The Lewis police have been out in the gator or whatever you call that
Mhm.
Yes,
thing on the trail that goes past the library.
right.
And that's been very helpful. It slowed people down.
The state park rangers have responsibility for the Gordon's Pond Trail, so we can certainly raise that issue.
Right. Well, you have to be very careful. I know here on Orchard Road, when we go down, I usually stop, but the bicyclists don't seem to. Now,
Yes.
the walkers do.
And the bikers should be stopping. And the same thing's true at Kings Highway too, Jim.
Right.
They don't stop there either.
Well, that doesn't even have to do with the coronavirus.
No, that's just
That's
trail safety.
common safety, I guess, not
Yeah.
Common
courtesy,
sense.
safety.
Yeah.
Do we have anything further to add, except that we want you to know when you join those coastal towns that, we're very much in support
Okay.
of your decisions in that regard.
Okay. Thank you very much. I will
Right.
convey that message tomorrow. I think the seven of us will, and the seven city managers are all pretty much on the same wavelength based upon my read of it. So,
Right. Then I think at this point we can adjourn.
okay.
Joe,
Anybody
do we
else?
need another meeting, or unless things change, I'm not so sure. We're sort of hashing over the same thing each time a little bit.
Well, in 2 weeks, we may have a better idea, Jim, as to what the governor might be doing with the 15th of May, because in 2 weeks, we'll be getting a lot closer to that. It might be worth scheduling another meeting about 2 weeks out to see where we are. The
Okay, I
governor's
don't
been
know.
holding these calls every week.
What would that date be? Anybody have a calendar handy?
Yeah, that would be May, 2 weeks from today would be May the 5th, 6th, excuse me,
6th,
6th of May.
great.
At 1?
Yes.
Works for me. That work for you, Nancy?
That's fine.
Okay,
For me,
Okay,
good, Susan, that's great. Make sure we get
All
that
right.
word out to Jane as well. And so,
Okay.
okay,
thank you very much for your attendance.
great. Thank
Yeah.
you for all your insight. We'll also try to get Dr. Tam to join us on the 6th as well. By
Okay,
then, he'll be able to give us a much more in-depth report as to
We should have a
But-
little better handle on things by then.
Absolutely, yeah.
Okay.
Thank you.
Thank you very
you.
much for your attendance.
Okay, thanks.
Thanks, Susan.